ফুলে ফুলে ঢলে ঢলে বহে কি বা মৃদুবাই ফুলে ফুলে ঢলে ঢলে বহে কি বা মৃদুবাই ফুলে ফুলে ঢলে ঢলে বহে কি বা মৃদুবাই তটিনী হিল্লোল তুলে কল্লোলে চলিয়া যায় তটিনী হিল্লোল তুলে কল্লোলে চলিয়া যায়.
Bangladesh is predominantly made up of rural communities, and in those communities, traditional birth attendants, also known as TBAs or DIs, are the birth care providers.
In the work of the midwife, the happiest thing is bringing the baby out, then giving it to its mother, holding the baby, giving it a bath. It is the happiest thing. My grandmother used to do it, my mother as well. This thing stays inside. It has to come from inside. DIs do a great job, and their work is very important for our society and community.
There's been a strategy to eradicate DIs in order to leave room for development of skilled birth attendants, but there's an enormous gap that can't be filled by skilled birth attendants.
DIs have experience, but they don't always know what to do and what not to do.
At Ganashastra Kendra, we are providing training almost 1,000 TPAs in each year.
I have come here to learn, but no matter how good I might be, I know I'm running behind you because I have no education like you, no books like you.
It is proved that even working with the DI, it is possible to reduce the maternal and infant mortality.
These current DIs need more skills in order to maintain and improve the safety of mothers and babies in Bangladesh. Ganashastra Kendra, which means People's Health Center, is the oldest, most long-lasting non-governmental organization or NGO in Bangladesh.
GK thinks about gender balance. GK's philosophy is to provide support to the disadvantaged girl or woman by providing training to get them involved in the health service sector.
Childbirth is a natural process. Traditional birth attendant, they were having for the years, time immemorial. They are the first physician of the world.
My mother was a DI. Many people take their patients to the hospital, but my mother never had to. My mother was such an experienced DI, she showed me how the job is done.
80% of the births occur in the home, even though there have been government and global health policy groups trying to move the births out of the home. In reality, most doctors don't want to work in rural areas. In reality, government institutions can't find providers.
TBAs are staying in the community, beside a pregnant mother, and they know each other's and they can talk freely to each other's.
They like to be there during the delivery. Even you didn't invite them, if they have the news, they will automatically go there.
We have to manage 4.2 million, and 85% of these 4.2 millions are the home deliveries. So you can imagine, without the TBS, it is not possible to help the pregnant mother in our country.
Automatically it will happen in our country that these natural resources will be replaced gradually by the more trained and educated person. Very few female from the village, they like to become a DI. Most of them become educated. If somebody like the health professional, they will become a paramedic or a nurse.
Nobody learns, not even my daughter. Moreover, they make fun of it and say I do a dirty job. I tell them, no, my dear, this is not a dirty work. This is necessary and rewarding work. I don't know what it will bring, but saving life is important. There is no better job.
Objectives of nature to reduce the maternal and infant mortality, morbidity and mortality. This is the main idea, So why we are strongly talking about to replace all the dies by the skilled birth attendant and others. It not something like that. Just right now stop everything, ignore all their services, push them out, and you replace them. It will not bring a good result.
It is important to improve the skills of all birth attendants, and to create skilled birth attendants, I totally support that. But in Bangladesh, there are 4 million births per year, and there is a shortage of skilled birth attendants. Only 3,000 to 4,000 have been trained since the strategy to eradicate dies began. It will take at least 20 years to train enough skilled birth attendants to attend the 4 million births.
So with these 20 years, what the pregnant mother will do, where they will go?
Some of the donors, they said that for the home delivery, they have to face a lot of problems. The TBS are creating a lot of problems. But in GK programs, from the statistics, we found that most of the problems are occurring in the hospitals, not in the home actually. So they blamed because they have actually no voice, and they are not recognized, and they are not well organized. They have no national organizations for their favor.
Although they are respected within their respective village, in terms of their social and economic status nationally, they are considered almost the lowest status of people. The remarkable accomplishment is that the GK doctors and paramedics and the directors have chosen to respect the DAI as the leader of maternal child health, and to take her status and almost turn it upside down from the lowest to the person that everyone needs to respect.
GK started working with DAI from 1972, and gradually GK trained them in their working area in all over the country, involved them in normal deliveries, how to conduct the normal delivery, what are the modern methods coming, what are the harmful practice and others. Get involved with them socially, so that they will not practice any harmful practice.
If we say there are problems, like the baby is upside down, then we do not do it at home. They have taught us this in training. When we see abnormal things, we call the GK phone to see if we should bring the patient there. If we cannot reach the GK phone, we bring her straight to the GK hospital. The dies of GK are very important. If there are no dies, the mortality rate will increase. If they have training and a good relationship with the paramedics and the GK hospital, this will be very beneficial. If I can do it better by understanding it better, then it will be good for all. I do have education, but I want to learn more. Then I will get better. For example, today they called us. They will explain things more and provide training. I will learn more. If they provide training, I will learn. If they have more training about women, midwife training, or another kind, I will join.
The GK doctors and paramedics actually know by name the DIs. The DIs call them on their cell phones. They can call a medical director. That type of relationship, that reality-based human interaction and human respect is what's missing in other parts of Bangladesh and other parts of the world, where traditional birth attendants have absolutely no interaction with other levels and higher levels in the healthcare provider team.
GK developed a special model. Yeah, GK provides the health services through a health team, and the consistency of the health team, the first one is the TBA, the second one is the paramedic, supported by the graduate doctors when it is possible.
When we have provided training to GK DIs, we always include the paramedics. When we train the paramedics, we tell them to keep close relationship with the DIs, as they have the close connection and they live in the community.
We know the philosophy of GK is to empower women and communities, so we have to do that one birth at a time. I was invited to collaborate with Ganeshasta Kendra. We introduced the workshops, helping babies breathe and suturing skills for the paramedics and the DIs. And those really came out of a request from the GK healthcare providers to do some hands-on skills workshops in addition to seminar lecture discussions. And there are many ways, but a lot of this comes with practice and attention. We did the Helping Babies Breathe class collaboratively in terms of who the students were, DIs, paramedics, and physicians of GK, and medical directors and junior doctors, and about 25 GK DIs. And this is why this is so amazing, this exchange with the DIs, the paramedics, and the doctors, exchanging so much important information. The collaboration in the classroom of learning skills and sharing cultural practices as well as evidence-based clinical practices taught by midwives educated in the U.S. was really a revolutionary kind of approach. We are recognized as doing the same work as the DIs and the paramedics, and because of those similarities, I think that we are becoming trusted members of the GK community.
We already achieved 2 MDGs goals, especially in the maternal and child. MDG 4 and 5 already we achieved, and TBAs have a great role to achieve these things.
The maternal mortality ratio, or MMR, has been steadily improving at GK. In data collected from GK, the MMR was significantly lower than both the MDG-5 target for Bangladesh, as well as the Bangladesh government reported data for the nation. It is our belief in our collaboration, and common sense would have us understand that a lot of that has to do with the way the DIs, the TBAs, have been integrated into the GK maternal child health system.
We have shown them the GK models that with the TBA and with this health team and the local government, the combination, it is very easy to maintain the GK achievements and to scale up this one all over the country, not only in Bangladesh, also other third world countries it is possible.
Moving forward, this is the approach that makes the most sense. To continue to improve the skills of the traditional birth attendants, to recognize them as the backbone of the maternal child health structure of Bangladesh that need to be honored, organized, recognized, and they are the ones that can fill the maternal child health gap as more skilled birth attendants are developed.